We have known since the late 1970s that screening with mammogram does not improve overall survival. It doesn't. You don't live longer if you screen with mammogram, and you for sure don't live better. So what are we doing? I went through my career as a surgical oncologist, as a breast cancer surgeon for 20 years, believing that mammograms save lives, that everything that I was taught in my training was true. I never had any reason to question it. And then when I got my own diagnosis and asked those questions that I had been asked thousands of times before. I mean, every woman wants to know why she got cancer, right? There is no one that can argue with me about radiation causing cancer, right? It is a known fact. It's indisputable. And you can ask any radiologist if radiation causes cancer, they say yes. If you ask them if mammograms cause cancer, they say no. We have been brainwashed.
This is StRest. I'm Kerstin Lindquist, health coach, author, and Emmy Award-winning TV host. I've committed to helping people reduce stress through impressive health science, attainable mindset change, and biblical truth. Let's have a real conversation with zero judgment and endless solutions that you can use. You aren't alone. You can do this. Let me help you reduce stress and make room for rest.
Wow, I will say it over and over again. God works in amazing ways, and there aren't a whole lot of coincidences, especially when you are doing the practice of asking the Lord what he wants you to know and what he wants you to do. 2 days ago, I found myself having a little bit of anxiety in an MRI machine, getting screened for breast cancer. There's no problems. I do have a heightened risk because of my mother and my grandmother, but there's no problems with my breasts. It's just they put me through the equation and it came out, hey, you qualify to get an MRI every 6 months as well as your mammogram every year. So I went in and I got my screening. Fast forward a day, and I'm here with Dr. Jenn Simmons talking about why we need to reconsider all of this screening. The very first thing that she told me before we hit record was, you're going to get some haters for this. Do you want me to really tell the truth? And of course, my answer was yes, absolutely. This episode of StRest could get me in a little bit of trouble. It could be one of those that many of you come back and say, how could you put that out there? But my job here as a medical researcher is to allow you to make decisions for yourself, to question everything that you're hearing and you're seeing and understand that every body is different. With the exception of all of us need to go back to the core basics of how you eat, how you sleep, how you move in relationships and spirituality. Before we jump in, let me tell you who Dr. Jenn Simmons is. She's a trailblazer in breast cancer care whose career was born from deep personal loss. She is the cousin of Linda Creed, that song, The Greatest Love of All, the greatest, that one, that hit #1 right before she died from metastatic breast cancer. So that was her cousin. That kind of changed Dr. Jenn Simmons' life. And she went into breast care. She has a practice, Real Health MD, which she blends conventional medicine with root cause healing, nutrition, lifestyle detoxification, and stress management to help women create a body where cancer cannot thrive. And I will say that over and over again. It's important to have a body where cancer does not thrive. She's also redefining early detection because she's the founder of the PerfeQtion Imaging, which is bringing safe, radiation-free, FDA-cleared breast imaging to people nationwide. She has a very powerful message, and she is encouraging you to ask questions. Sit back and listen and learn and take advantage of all of this information to care for yourself and your breast health. Dr. Jenn Simmons, thanks so much for being here on your birthday. Who was that who just told me it's your birthday?
No, that was my husband.
Okay, I thought it was your husband.
Biggest fan by far.
Of course he is. What y'all didn't see before we started recording is she stepped away and her husband and the pups. You have 4 dogs jumped in. Yeah, that's fantastic.
We
And
actually
tell
have
me-
5 living here right now because my mother had surgery on Thursday, so just 5 days ago. And so she's here recuperating. Her dog's here. My 4 dogs. My son's home from college. It's a zoo in my house. It's all
but
good.
it's beautiful. It's
Yeah,
beautiful.
it's all
And thank
good.
you for taking the time to talk to us. And the reason that I wanted to have you on this podcast is because I think that the information that you give when it comes to women and breast health is so important. We are trained for so long since the first moment that we walk into a gynecologist office, and we just kind of blindly, like we do in all medicine, do exactly what our doctor says. And we are in this time, thankfully, where we can do research and we can be more educated. And I feel like people need to understand there's different sides of the story.
Yeah, there are. And we are a conditioned population. I mean, never have we seen that more than in the last 5 years with don't ask questions, just accept the status quo. This is the gold standard. And that whole paternalistic mindset of doctor knows best is so dated and it's not serving us anymore. And we don't tolerate it in other areas of our life. And we for sure shouldn't tolerate it with our health.
If you could hold the hand of every single woman who has to go into the doctor and have a conversation about breast health, if you were there with them, what would you tell them to do? How would this go?
Well, I think the main thing that I would tell them not to do is don't put yourself in harm's way, especially for the purposes of screening. Gilbert Welch is a brilliant, brilliant physician. He wrote a book called Overdiagnosed. It came out in 2014. And he talks about the multiple areas where this is happening, this whole concept of overdiagnosis, where we take a disease state and we continue to lower the threshold to get the diagnosis. And so we have been brainwashed into believing that it's okay to take a normal, healthy, asymptomatic woman who, for all intents and purposes, we have no reason to believe that she has disease, right? And we have decided that it's okay to subject her to 20 to 50 pounds of compression and add radiation on top of that, at least every year. Like, in what universe is that okay? And yet, we have bought the narrative hook, line, and sinker, despite the fact that there is evidence that has been available to the general population for decades. We have known since the late 1970s that screening with mammogram does not improve overall survival. It doesn't. You don't live longer if you screen with mammogram, and you for sure don't live better. So what are we doing?
Stay with us. There's so much more to come.
I'm super into the research right now when it comes to creatine and collagen. In fact, let's talk creatine for a second. And the one that I trust happens to be Ancient Nutrition. Research shows that women naturally have 70 to 80% lower creatine stores than men, which means we're ideal candidates for it. And collagen we know is important not only as a protein, but it's also great for joint health. And I've been feeling the joints a little bit more. I'm in my 40s. I have that cold shoulder women's 40 thing that there's a lot of different things we can do, but it's really important to pump up your collagen. So I'm doing the two together, collagen and creatine, and there's actually a new product from Ancient Nutrition that puts the two of those together. Creatine is one of the most clinically studied supplements, and it's a game changer for women's wellness. It supports cognitive health. That's what I love the most about it. Muscle endurance and recovery, and it helps you build long, lean muscles and strength while staying sharp. And then you pair that with clinically studied collagen, which is what we get from all of our Ancient Nutrition products, and that can help you improve your joint comfort, your mobility, and your recovery. I take it right after a workout in the morning, and I still also love multi-collagen proteins and those peptides in my coffee every morning as well. So support your brain and your body and your beauty every single day with Ancient Nutrition so you can look toned, you can feel strong, and you can stay sharp. Here's what you do. You go over to ancientnutrition.com and put in the code StRest20. That's STREST20, StRest20 at checkout, and you'll get 20% off site-wide. Get your collagen, get your creatine, get your Ancient Nutrition. So tell me how that works, doctor,
Yeah.
because I can recite it in my brain. Early detection saves lives. Know first and save lives. Is that just not true?
It's just not true.
Where is this
Early
coming from?
detection definitely leads to more disease in terms of more diagnoses. But when you look at the absolute numbers of women who die from breast cancer every year, it hasn't changed. It hasn't changed in decades. We are not impacting the bottom line. If you look at it from a percentage standpoint, does it look better? Yes. But it's always going to look better if you increase the denominator, right? Because it's going to make that number look smaller. But if you are just diagnosing people for the purposes of diagnosing them and getting them into the system to be treated, those women are going to suffer majorly and for absolutely no reason. So there were two quintessential studies that I always cite. And the first are the group of Swedish studies. So this is 600,000 women. These studies were done in Sweden where there is universal health care. So everyone has the same access to care. Everyone gets the same kind of care. So it's not between the haves and the have-nots. People aren't, wealthy people don't get preferential treatment. Everyone gets the same treatment. So half of the women screen with mammogram, half of the women just have physical exam every year or whatever their doctor deemed appropriate without mammogram. And when we look at the data, the exact same number of women die of breast cancer in each group. There's no difference in the deaths from breast cancer. And the only difference that we see, and this is reproducible time and time again, is that if you use mammogram to screen, you are going to diagnose somewhere between 20 to 30% more cancers. This is the concept of overdiagnosis. This is the concept that Dr. Gilbert Welch was talking about. And the significance of it is that had we not been screening with mammogram, these women would have never developed clinical disease. It would have never come to their attention. They would have never developed a mass. They would have never died of breast cancer. But because we screened them with mammogram and because we found these subclinical lesions and because they then get a diagnosis, they get into the system, they get treated for breast cancer. Now, if treatment for breast cancer were some benign thing, that would be something, right? Like it wouldn't matter so much. But treatment for breast cancer is not benign. Treatment for breast cancer increases your risk of cardiovascular disease by far and away, exponentially the number one threat to a woman's life.
Yeah.
Screening, being treated for breast cancer increases your risk of neurodegenerative disease. We are on the threshold of an Alzheimer's epidemic. We don't need help in the area of accelerating neurodegenerative disease. It accelerates bone loss, osteoporosis. And lest we forget, the same number of women that die of breast cancer every year die of a complication of a fracture. So our bone health matters. And yet we are taking these women who have subclinical disease. They are completely asymptomatic. We are giving them a diagnosis. So forever changing them in terms of their mindset, their belief in their health, and fundamentally negatively affecting their health. And then we are even saying, well, she didn't die of breast cancer, so I helped her, right? It's like pushing someone in front of a train, pulling them back and saying, hey, I saved your life. Like,
So
did you?
let me understand. You're saying these women who might be getting diagnosed early on, asymptomatic, what they have might never actually turn into full-blown breast cancer, but it's being
Yes.
treated for it?
Yes. Yes. So we know from autopsy studies from women that died not of breast cancer, but of they died in car accidents, overdoses, suicides, that kind of thing. If we were to do biopsies on their breasts, 1 in 5 women would have histologic evidence, microscopic evidence of breast cancer. And yet 1 in 5 women do not have breast cancer, and that's all comers. That's at all ages. Whereas the incidence of breast cancer in a 20-year-old is not 1 in 5,
Mm-hmm.
right? It's like 1 in like thousands, right? So many thousands, tens of thousands, could even be hundreds of thousands. I forget what the incidence is in 20-year-olds. But there is, I mean, everyone makes cancer cells from the very young to the very old, everyone in between. And just because you have cancer cells doesn't mean you have cancer. And we need to be able to distinguish between who has histologic evidence, microscopic evidence, and who actually has the disease. Because the person that just has microscopic evidence, they don't need to be treated. They don't need to be treated at all. And many of them will never come to treatment if we would stop using this inferior technology.
What I'm hearing you saying, and it's absolutely changing the way that I'm thinking about things, which I love, which is the reason that we have this podcast, is for us to ask questions and to consider different things about our health, is that if we all have some of these cells and there's a possibility that they could show up on something, you have the power in your own health to eat, sleep, move, relationships, and spirituality, treat yourself better so that these cells inside your body don't express. Just like we talk about with genetics, just because you have a gene doesn't mean that it's going to express itself.
That's
And what
exactly
we're
right.
doing instead is, let's take it over to the genetic side, saying, well, you have this gene, so we're going to operate on you before it even comes into fruition. Us now knowing as researchers and experts that not all genes are ever expressed because your lifestyle is what turns it on.
Mhm. That's exactly right. And even in the case of the BRCA mutation carriers, and this is a genetic mutation, it's probably the one that's the most known and most associated with the subsequent development of breast and ovarian cancer. Even in that population, we're not recommending prophylactic surgery anymore because there's no survival advantage.
Mm-hmm.
And we are all so much better off minding our health. And when you take someone like a BRCA mutation carrier, these genes, these mutations, these shifts, they represent shifts in our tumor suppressor genes. This is our anti-cancer system, right? So if you have already demonstrated that you can't handle environmental insults because you have a genetic predisposition and you have difficulty repairing the damage that comes from these environmental insults, the very way to guarantee that these women get breast cancer is to screen them early and screen them often. And that's exactly what we're doing. We are creating the very disease that we pretend to care about, to want to avoid, to want to prevent. We are creating it.
Are they pretending? Are doctors pretending, or do they just truly believe that mammograms are saving lives?
I don't think they're pretending. I think that when we train as physicians, and I am as guilty of this as anyone, we are rewarded for being critical thinkers to a point. So when we're in grade school, when we're in college, when we're preparing to go to medical school, we are really rewarded for critical thought. Once you get into medical school, there's dogma. It's just dogma. It's like, this is what I say. This is true. Don't question it. And the people that question it are ostracized.
Mm-hmm.
So I had no reason to believe that what I was taught was untrue, wrong, any of it. And I went through my career as a surgical oncologist, as a breast cancer surgeon for 20 years, believing that mammograms save lives, that everything that I was taught in my training was true. I never had any reason to question it. And then when I got my own diagnosis and asked those questions that I had been asked thousands of times before, I mean, every woman wants to know why she got cancer, right? Every woman wants to know. And when I got my thyroid diagnosis, I wanted to know why. And I was given the same reason that everyone else is given. There's nothing you can do. It's just bad luck. It's just something that happens. You have no control. And that narrative is very much desired within our system. They want us to farm out our control to them, right? Because if they control the narrative, then they control how you're treated and what happens to you, and they can create a customer for life. So it wasn't until it was happening to me that I even asked the questions and the answers were insufficient. I didn't want to hear that there was nothing I could do. That was absurd to me, despite the fact that that's what I said to people all day, every day, without hesitation or reservation. But when those words are coming at you, I assure you it is a different experience. And it sent me on this journey of discovery because all I could hear in that time and space when I was told that I needed surgery and chemo and radiation, and I was running a cancer program at the time. I knew what he was telling me was the gold standard. And yet, I couldn't quiet that voice in my head that said, there's something more, go find it. And I went on a journey. It was a very selfish journey. This was about healing myself. This was about raising my boys. This was about fulfilling my mission. And it wasn't until I got into it and learned about functional medicine and trained in functional medicine, it wasn't until then that I realized how big my mission really was. Because my mission wasn't to escort these women from their diagnosis through surgery. Like, I wasn't fundamentally changing their health. I wasn't fundamentally changing their life. I was a kind voice. I was a shoulder to cry on and to lean on, but I was not fundamentally changing their life or their health. But in functional medicine and doing what I do now, where I am forever changing how we diagnose, how we treat, how we screen for breast cancer. Now, this is a mission. This is a mission.
Yeah.
And it's disrupting an entire industry who is not interested in being disrupted.
What do you tell women now when they are, let's go just straight to diagnosis, diagnosed with breast cancer?
Well, the first thing
Where
I
do you lead them?
say is that do nothing. Take a breath, take a pause. It feels like an emergency. It
Mhm.
seems like an emergency. It is not an emergency, with rare exception. There are some times and some situations where I do think that you need to get to treatment immediately. So I'm talking about if someone has a big, red, inflamed breast with an underlying mass that seemed to come out overnight. This is either an infection or inflammatory breast cancer, and it doesn't matter. This needs immediate medical attention. If you have breast cancer that has metastasized to the bones, that in itself is not an emergency. But if it has caused a fracture, it is nearly impossible to heal when you are in pain, and these fractures are very, very painful. So this is another area that I think needs immediate attention because you need to get out of pain in order to start to heal. And then the third emergent situation is if you have metastasis to your brain, because the skull is a fixed space. So you won't tolerate too much swelling there. So this is another thing that needs semi-emergent intervention. And if you don't meet any of these criteria, take a breath, take a pause, learn, get comfortable, build your team, work on your health, work on the foundations of health. Know who you are, know who you want, know your mission, right? And work on all of that. All of the things that are so blaringly absent from our conventional system, just absent. No one is talking to you about what you eat and what you drink and how you move and how you think and how you sleep and how you detox and how you pray and what your purpose is. Like, they're not talking about it. They're not talking about it. They weren't taught. They don't understand the importance of it. And they are, I mean, I hate to say it, unknowing, very much unknowing pawns in a game. And so many women just get stuck in this vacuum of fear. They're so afraid, and the fear is really leveraged. Like, you have to sign up for surgery, and you have to sign up for chemo, and you have to sign up for radiation. We have to get you on the schedule. And you're so scared that you buy into it because you don't know what else to do. And I get it. But that's also why I wrote The Smart Woman's Guide to Breast Cancer. So this is my book that came out last year. And the reason that I wrote this book is because I want women to be able to make informed decisions, because right now they're not. Right now, they do not have the ability to make an informed decision because they are not given the information in order to do that. And as much as my book is for that woman who is newly diagnosed, it's also for the woman who was diagnosed 2 years ago, 5 years ago, 10 years ago, who didn't get the information that she needed then. And she wants to be healthy and she feels awful. She's the forgotten woman. She's the woman who went through breast cancer treatment and is told that she should be grateful to be alive. And she is grateful. But it is very hard to feel grateful when you can't think and you're scared and you're depressed and you're anxious and you can't sleep and you've gained weight and you don't recognize your body. Your bones ache, your joints ache. You have no libido, sex is unwanted and painful. You have recurrent urinary tract infections. You have recurrent yeast infections. You've lost your relationship. It's very hard to feel grateful when all of this is going on. And yet, this is how we are leaving most women after breast cancer treatment.
Yeah, it's very
So
true.
it was very important to me to address that woman too, so that that woman has a path forward. And then lastly, we all need to know how to prevent breast cancer. And we're doing the same things to prevent breast cancer as we're doing to prevent a recurrence. So it was so important to me to put this book out there so that women could sit in their own power. We cannot be farming out our health to people who are not qualified to be responsible for it. And that's what we're dealing with right now.
And I will be the first person to say I have not had breast cancer or had a cancer diagnosis. I have undergone testing, not for breast cancer, but for other types. And I remember sitting in that fear for a week while you wait for the MRI to come back, and that fear being absolutely debilitating. But I've never had the fear of you have breast cancer. So I say all these words with, please have some grace for me in saying this, but making decisions under fear and being reactionary and treating your doctor as God in these situations is not what you need to be doing. This
Yeah.
is where it is essential that you have faith, that
Yeah.
you have a relationship with the Lord, that you have a relationship with people other than your doctor who can help you, that you have a team for nutrition, for sleep if you need it, for stress management, but not making a decision under fear because you just got the words, you have cancer.
You're exactly right. And we know that when we are in that stress state, that cortisol dominant state, that fight or flight state, we do not make good decisions because we are not supposed to think in those moments. So we are modern beings living on a very old gene code, right? So we only really understand primitive threats. We don't understand bad news, right? We don't understand your phone ringing 1,000 times. We don't understand getting cut off in traffic. We understand a saber-toothed tiger on our tail. That's it. That's all we understand. So if you have a saber-toothed tiger on your tail, you can't turn around and say, hey, can you give me a minute? I need to plot my escape, right? You just run. And what do you need to run? You need blood flow to go to your muscles, not to your brain. You don't want your brain saying, I wonder if I should go this way, or maybe I should go that way. You just want your brain to run. Run, 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 run. Your eyesight gets better. Your muscles get filled with glucose and you run, right? But what's not working well is your brain. Your monkey brain it's telling your body to go, go, go. But your thought, the thinking part of your brain, the frontal lobe, that is shut off. So how do we expect these women who you sit them down and you say, I'm so sorry to tell you that you have breast cancer. Can you have surgery on Tuesday? Because that's when my schedule is open and I want to get it done as quickly as possible. Can you imagine? And yet this is what is happening day in and day out in surgical oncology offices, in medical oncology offices, in radiation oncology offices all over the world. And I'm not trying to insult what they do, because these doctors train for a very long time to do what they do. And they do their job for the most part. Of course, there are exceptions, but they do their job very well. They do exactly what they were trained to do, and they do it really well. The problem is we're training people to do the wrong thing. And until we have enough people to say, hey, wait, I want to slow down. I want to think about this. I want to learn about this. I want to make the right decision for me. I understand that this is how you treat everyone, but I want to make the right decision for me. And I need the time and space to do that. And I can't do it in this moment when I'm terrified.
Mhm. Doctor, does stress cause cancer?
Absolutely. But it's not a direct relationship. And some people manage stress better than others. And it depends how much reserve you have and your genetics and how you handle stress and how many tools you have in your toolbox. But we know that there is a physiologic response to stress, right? And it does elevate cortisol, which will elevate glucose, which will elevate insulin, which will elevate insulin-like growth factor, which will cause mutations. And if your immune system is not intact and hardy, it's not going to recognize those mutations in their infancy. So those mutated cells are going to be allowed to grow and grow and grow. And before you know it, you have a tumor that has evaded the immune system because the immune system is exhausted from all the stress, right? And so it's a feed forward loop that keeps you sick and vulnerable. And we're not talking about it enough. People don't understand it enough. And we're not being given the tools to deal with this day in and day out. And so we suffer.
We'll be right back. Don't go away. It's just getting good.
I think if you've learned anything from this podcast, you know that a pill or a shot isn't the answer alone. You have to have support and guidance and a plan that actually fits your life. That's why I've partnered with Vivoro. Vivoro is a high support telehealth option for busy professionals. It's clinically reviewed, personalized medication that's shipped to your door with ongoing concierge support. So your progress feels simple, safe, and sustainable. They include free fitness and nutrition resources because they know that this isn't just about medication. It's about building habits that last. Use code Kerstin50 for $50 off your first month at Vivoro.com. That's Vivoro.com and Kerstin50 for $50 off. What do we need to avoid breast cancer?
Yeah. So everything, right? All kidding aside, I mean, no one can construct the perfect life. Like, that's just not happening. It's not realistic. However, we can be mindful and cognizant of what we eat and what we drink and avoiding toxins and having detoxification practices and prioritizing sleep and prioritizing movement and not living a sedentary life and having a spiritual practice, whatever that looks like, be it religious, be it meditative, doesn't matter, living life with meaning and purpose. This all will work towards the creation of health. That said, do we all have a genetic code that needs to be minded? Yes. So maybe your ability to navigate the toxins in your environment is better than my ability to navigate the toxins in my environment because I came down with thyroid cancer, right? So I exceeded my toxic load and my body wasn't able to clear it at the time. Now, once I worked on all the things that I needed to work on, yes, because I did not have conventional treatment. However, it takes a comprehensive plan. And part of that plan, as far as I'm concerned, are utilizing actionable genes where we can look at our genetic makeup and do the things that we need to do to nurture our nature. So, for instance, if you're someone that you find out based on your genetics that you don't methylate well, well, maybe you need methylation support, right? If you're someone that can't convert a bunch of these vitamin precursors to the active form because of your genetic makeup, you need to take the active form. If you are someone who prefers to be plant-based, but your body can't break down plant-based proteins, you're going to develop disease, right? And so it's being mindful and aware of those things and respecting your genetics and nurturing your nature.
So then would you recommend genomic testing to everybody? Like get that testing
I
done?
do, but not in the way that you're probably thinking about it, because most people think, oh, I need one of those high risk breast and ovarian profiles. So I need to check for BRCA and for PALB2 and for CHEK2 and all these mutations that we commonly hear about. That's not what I'm talking about. I am talking about actionable genes. I am talking about genes that say how you should eat and how you should sleep and how you should move and how you should detox and how you should supplement, right? That's one of the biggest things is so many people have a supplement graveyard and they're just taking these things. And sometimes those things can actually be harmful to you.
Yeah.
So
I love
you
that
want to
you're
know what your body needs and
right.
what it doesn't. Like save the money.
Yeah, it's one of the things that I always tell people. It's there's a lot of tests you can get out there and you can spend thousands and thousands and thousands of dollars in tests. I always recommend people to get blood work done. Absolutely. And I love these new programs that are coming out where you can, like Function Health and Superpower and you can kind of take that
Love
into your own
function
hands.
health. Love function health.
Fantastic. Yeah, it's great. Um and it's also very rewarding when you come back with a younger biological age because you're
I
doing something
know.
right.
I'm
All of those things are good.
37.
I know. I'm 36 the other day. I was like, oh, so good. But I always recommend I like Designs for Health. They do a genomics test, which is exactly what you're talking about, because I don't want to tell somebody, take all of these supplements if your body maybe doesn't need that support. Maybe we shouldn't be throwing all of our support into your cardiac, or we shouldn't be throwing all of our support into your cognition, because what you really need is structural support.
Mm-hmm.
So getting one of these tests done, which I think are like $300 or $400, it's not horrible, can help you actually save money in the long run because it
Yes.
tells you where to be putting your attention.
Yes. And for my part, I mean, I use the nutrition genome, I use DNA 360, and I think it doesn't matter. But I do think that most of what we think of as genetic testing, like those high risk breast and ovarian panels, I think that is a colossal waste of money, because that is just the system giving itself permission to image you more.
Yeah.
And it will increase the likelihood that you are diagnosed with breast cancer by 30%.
So let's go back to that because now I'm feeling very, like, oh, well, my mom had breast cancer. She didn't die from it, but she had breast cancer. My grandmother had breast cancer, didn't die from it, but had it. So I'm considered high risk. I've got little baby dense breasts.
Mm-hmm.
So of course the recommendation for me is, since I was like 35, was yearly mammograms. And now it's yearly mammograms and yearly MRIs.
Mm-hmm.
Uh-huh.
Yeah.
Tell me, if you were my doctor, what
to
you
make
would be
you
saying.
a patient, my dear. I mean,
So-
you're on the hamster wheel, right? Come back,
Right.
come back, come back, come back, right? And no one is healthier for it. It does not increase survival. There has never been a study that demonstrated that increases survival. So what I say to people is, I don't believe in putting healthy women in harm's way. So we're talking about women that even if you have an increased risk, even if we don't think that you have a reason to have breast cancer right now, you don't feel a lump in your breast, you don't have nipple discharge, you don't have any change in the appearance of your breast, you are asymptomatic and screening, why on earth would I expose you to radiation, expose you to gadolinium? These are known toxins. There is no one that can argue with me about radiation causing cancer, right? It is a known fact. It's indisputable. And you can ask any radiologist if radiation causes cancer, they say yes. If you ask them if mammograms cause cancer, they say no. Make it make sense.
So tell
How
me,
is it possible?
how is it possible? Because, and I'm not disagreeing with you, but I'm playing devil's advocate.
Yeah.
I've had people on this podcast in the same industry as you saying you get more radiation by going on an airplane, Kerstin.
Well, but when you go on an airplane, that is scattered radiation. So it is not directed at one place. It is not focused. It is scattered radiation. Some of it might hit you, some of it might not, most of it won't penetrate. That is entirely different than the focused cone down radiation that we get during a mammogram. It's entirely different. So think about the difference between, have you ever had a laser treatment on your face?
Not yet, but I want one. Should I not get one though?
No. That's not my point.
Okay.
I'm all for them. So, but if you've ever seen a laser treatment being done on the face,
yeah.
it goes on for a fraction of a second, and it's capable of great tissue damage. It's very intentional. It's meant to damage the tissue so that you mount an inflammatory response and there's collagen laid down and you have better structural results afterwards, right? But the sun has infinitely more energy than that laser, infinitely. And yet, you can stand in the sun for hours and not have anything happen to you. What happens to you if you stand in front of that laser for hours?
Oh, goodness. Be gone.
You'd be dead.
Yeah.
You'd be dead, right? These are not the same thing. You cannot compare the scattered radiation that you get from the airport or from any kind of general radiation exposure to the focused cone down radiation that you get during a mammogram. You can't. And the amount of radiation that each woman is getting during a mammogram varies. So it's not like there's one standard dose. There's not. So you need as much as you need in order to penetrate those tissues. So if you have a dense breast, you need higher levels of radiation because it has to penetrate the tissues. If you have a larger breast, you need higher levels of radiation because it has to penetrate the tissues. So where's the cutoff? Where is the cutoff between safe and not safe? Where can we say, oh, this is too much exposure, but this is okay, right? Where's the cutoff? It doesn't exist. We've told a story. We've created a narrative for the purposes of women using this technology, but it's not true. And there have been a bunch of narratives over the years that are simply not true, that are accepted as dogma. But the time of dogma needs to end. Now, listen, if you're perfectly happy with your mammogram, you can ignore me. If what I'm saying is making you feel icky and uncomfortable, ask yourself why. And know that 35% of women are opting out. And that's who I'm talking to. I am talking to the 35% of women who are in the screening population who are opting out, who are not interested in putting themselves in harm's way for the purposes of screening. And those women are listening to me. Those women want to know, how can I screen for breast cancer 100% safely, 100% painlessly, and accurately? How can I do that? These are the women that I'm talking to. Some women will never hear my message, and that's okay. That's okay. Right? We are all entitled to make our own decisions.
And it's very important to hear what the doctor is saying. If you have signs and symptoms of breast cancer, you need to go get screened and get that checked out.
100%.
But if you are healthy,
I'm not saying that you will never have another mammogram again. I'm saying that no one ever needs another screening mammogram again. Ever. But
so what do we do instead?
A mass, if you have some reason to believe that you have an abnormality in your breast, by all means, you have to speak the language of the people that are going to take care of you. And the language that the breast surgeons speak, that the medical oncologists speak, that the radiation oncologists speak, that language is mammogram, ultrasound, MRI. So get them.
So what do we do instead? I am
This is
very
my
healthy.
favorite part.
I blood work gets done. There is no inflammation living in my body right now. I have no signs and symptoms, but I'm still being told every 6 months I need to have some type of screening for breast cancer.
I
What do
know.
I do instead?
I know, right? They have you very well trained.
Mhm.
So you mentioned that you have no inflammation in your body. Maybe that's
Maybe.
true.
Okay.
Let's check. So, the first thing I tell everyone to do is you should be doing a monthly breast examination. Know what your breasts feel like when they're normal so that you can know what they feel like when they're abnormal. And most women believe that their breasts are lumpy. It's okay, own your lumps. The second thing is something called the ARIA test. So, this is a test that is done on your tears. No, you don't have to poke yourself in the eye. No, you don't have to make yourself cry. This is a tiny litmus paper that you put in your eye for 5 minutes, send it off to the company, and the company sends it back a week and a half later with one of two choices. Either it's negative and you do not have the risk factors for breast cancer, or it's clinically positive. Now, it has a 93% sensitivity. So, 93% of the time, if you have breast cancer, this test will pick it up.
Wow.
This is better than any mammogram ever. Ever. It's better than QT. It's way better than ultrasound. It is not as good as MRI, which has like a 98 or a 99% sensitivity. However, MRIs have a lot of false positives and lead to a lot of unnecessary biopsies, overdiagnosis, and overtreatment. And just ask the woman who was told that her MRI is universally abnormal, went in to have her surgery, told she needed a mastectomy, and the pathology comes back the next week and there's no disease in the breast, because that happens. That
Wow.
happens. So I do not use MR for screening for that reason, because it is so notorious at overdiagnosis. So the sensitivity the sensitivity 93%. The specificity, meaning that the number of people who don't have breast cancer but that this test is positive, that number is 58%. Now, people get themselves in an uproar that that is too high a false positive rate. Let me assure you, there are no false positives for this test. This is not a test for breast cancer. This is a test for the inflammatory precursors of breast cancer. So if your test is positive, you do have the inflammatory precursors to breast cancer. So what do you need? You need a scan of some sort. I generally recommend a QT scan if you're near PerfeQtion Imaging in Philadelphia, but if you're not, you can have an ultrasound. And if that is negative, what do you have? You have opportunity. You have the opportunity to find out where that inflammation is coming from and to prevent a breast cancer diagnosis. How beautiful is that? This is the next wave in how we are going to screen for breast cancer. 100% safe, 100% painless, extremely accurate, available everywhere except for New York. Sorry. New York needs to be annexed. But that's a conversation for another time.
Whole nother podcast.
Yeah, that's a whole other podcast. And it's not yet for the women who had breast cancer because it has not been validated for recurrence. But if you are doing primary screening, this is what you should be doing primary screening with, all from the comfort of your own home. A 5-minute test from the comfort of your own home. Like, what could be better?
So if you are that woman who breast cancer runs in your family, or you just have that fear, some people, every woman I coach, the reason that she's in coaching, health coaching, is because she has some type of desire to control her health outcome because she saw somebody else suffer or die in her family.
Yep.
100% of them. It's
Yep.
this desire to control it, right?
What better way to take control?
For me, it's Alzheimer's is my big one because I saw my mother die from that. But a lot of women, it is breast cancer, and they're just petrified. Maybe they don't have any signs or symptoms, but they're petrified, so they're consistently getting screened and scanned. This is for you. This test. Why have I not heard about this tear test before? And is
I
it
don't
just
know.
for breast cancer, or is it cancer in general?
This one is just for breast cancer, but I am
Okay.
100% certain that this technology is going to be used in the future to screen for other cancer modalities. But for right now, this is just for breast cancer. It's extremely easy, painless. I recommend anyone who wants to safely, painlessly, easily screen for breast cancer, do this test every year. And if you are high risk, if you are worried, then you can do it every 6 months. There's no reason why you couldn't.
There's
Now,
no radiation.
if you do have a clinically positive result, then I recommend that you work on the inflammation, read my book, The Smart Woman's Guide to Breast Cancer, and then have this test done every 6 months until it converts to negative. And it will. We've seen it time and time again.
And the QT testing that you can get in Philadelphia, is that the only place where you can get it?
You can get it in other states, but I own PerfeQtion Imaging, which is in Philadelphia, and I am expanding all over the country. No, I'm not going internationally. I don't know what your listenership is like, but I'm going to stick to the United States and open at least 50 of these because it's very important to me that women who want access to safe and painless and, quite frankly, humane breast cancer screening get access to that. And that is not unique to the screening population. If you have a history of breast cancer, we're screening you. If you have dense breasts, we're screening you. If you have implants, we're screening you. That's what this technology was built for. And it is sound wave technology transmitted through a water bath. It's like a spa day for your breast. It is a lovely procedure. Most people take a nap, and it creates a true 3D reconstruction of the breast without pain, without compression, without radiation, without gadolinium.
What are some of the biggest health risk factors that you see for women when it comes to breast health and it comes to breast cancer?
Yeah. I think there's a tie between being overweight or obese, because that is a very inflammatory state and it increases our inflammatory mediators and actually sets the stage for breast cancer. It's between that and frequent alcohol use. And when I say frequent, I even mean like occasional users, the people that say, I just have a drink a week. The American Cancer Society says there is no safe amount of alcohol for women, unfortunately. Like, don't shoot the messenger. But I made my own personal decision last year at this time at Thanksgiving that I wasn't going to drink alcohol anymore. First of all, I want to walk my talk and I want to be the light for people. And second of all, I hated how I felt afterwards. I hated waking up the next day and just feeling lousy. It's awful. It's awful. And we have normalized alcohol consumption so much that we have actually created this culture where people are indignant. I remember I had a woman come to me, it was during COVID, so it's many, many years ago now, and she's a nutritionist and she drinks a glass of wine every single night while she cooks dinner. And I said to her, you need to stop that. Like, you have a breast cancer diagnosis now. You're saying you don't know where it came from. I'm not saying that it came from the alcohol, but I know it's not helping. You need to stop that. And she fired me. She said I blamed her for her breast cancer. And I understand that people can feel that way, right? And we have been so conditioned to think that, even there was a narrative that red wine is good for you, right? It contains lots of antioxidants and resveratrol. And we have really been conditioned to believe that that's true. But the truth is that alcohol is very, very harmful, especially in the postmenopausal woman who is no longer bleeding. So she's not getting rid of her toxins every month, right? They're just building up and building up and building up. And especially in the woman who wants to pursue hormone replacement, because if your body is busy metabolizing that alcohol, it doesn't have the time to get through those hormones. It's very dangerous.
Yeah, that's a big conversation right now, which I think is wonderfully being had from practitioners like Cynthia Thurlow and others, that if you are on HRT, which I am, and I believe it to be a wonderful thing that we can do, and that's a whole different discussion, but there's no place for alcohol because it magnifies the ill effects on the body when you're HRT and alcohol.
You're absolutely correct. And in this moment of time when we are on the precipice of really making up for the Women's Health Initiative, for all the bad information that has been circulating for the last 20 some years, I will tell you that I am a huge believer in HRT, but we have to do it right. And unfortunately, because of the Women's Health Initiative, we have 2 decades of practitioners that are untrained and undertrained, that they are pretty hormone ignorant, and we're going to have that pendulum swing the other way and maybe cause a little more harm before we get it back right. But what I always say is that hormones are that bow on top of the box, right? And the box is filled with all of those foundational tools that we know drive health. So, eating the diet that's right for you, avoiding alcohol, drinking clean water, prioritizing sleep, prioritizing movement, lifting weights, having a detox practice, avoiding toxins, decreasing the amount of toxins that you are exposing yourself to every day, week, month, and having a purpose-driven life where you really believe in what you're doing, and what you're doing is making a fundamental difference. And it doesn't have to be like a worldwide difference. It can just be your world. That's all you're responsible for. God put us all here with a very unique mission, and my mission isn't yours and yours isn't mine. And I'm not expected to be a better version of you, and you're not expected to be a better version of me. We are expected to be the very best version of ourselves. And sometimes that just takes a long look in the mirror and asking, am I really doing what I'm supposed to be doing? Am I living life to the fullest? When I meet my maker and he says, did you partake in everything that this world had to offer you? Can you honestly say yes?
Yeah, getting those priorities straight, understanding your
Yes.
purpose and your identity. And they're 2 different things, but being clear on them, and sometimes making the hard decisions, the things that build resilience, the good stress in your life that
Yeah,
allow you to say no to something maybe that feels comfortable and chase hard after purpose. We know from the research
that's
that people who
exactly
have a
right.
sense of purpose live longer.
Yeah. Yeah. And sometimes it's very hard.
Very hard.
For those of us that are disrupting and paving the way, there are lots of decisions that are hard, and the road is filled with treachery, but it's okay. You just need to keep going, keep moving in the right direction. My friend, Dr. Kellyanne Petrucci, always says to me, no matter how high that mountain is, just keep going forward.
If a woman could do one thing right now to change in her lifestyle that could help with her breast health, what would it be?
Ooh, um, I, oh, it's such a hard question.
And there might be a
Um,
couple of them. We hit on some of them, but
yeah. Yeah. I I think just work on the foundations of health. I think so many people get caught up in that I need this gadget and I need that gadget and I need this tool and I need this test. And the truth is that for the most part, you really don't. So if you don't have the foundations in place, work on that first. And I think a
absolutely.
wonderful way of knowing that is if you can come up with that lab testing yourself, fine. If not, use that Function Health site
Hmm.
and look at these biomarkers and know what needs to be changed, because we know that breast cancer is an environmental disease, breast cancer is a metabolic disease. And if your environment isn't healthy, if your metabolism isn't healthy, if your metabolic health isn't where it's supposed to be, you need to work on that.
Are there, speaking of toxins, things that you now do other than don't get MRIs and mammograms to reduce the toxic load that somebody has in their life or that you have in your life, especially
Yeah,
after surviving
yeah,
cancer yourself?
yeah. So there's a lot of take the trash out.
Hmm.
I don't have a lot of friends, right?
Mm.
I have
Wow.
amazing, amazing, amazing friends, but I don't have a lot of friends. I have a core group of ladies, and ladies, you know who you are and you know how much I love you. I have a core group of ladies who I lean on, who lean on me, who we are walking this journey together, right? And so that is one thing that is really, really, really important to me. And then it's like a little shameful for me, but I definitely was a sugar addict and especially a birthday cake addict. Lauren, I do apologize once more for having eaten the entire birthday cake at Josh's 1-year birthday party. I'm sorry for that. I am sorry for that. Um, so I used to be in the mindset that if I wasn't fat, I was healthy and my eating habits were fine. So that has changed monumentally. And the other thing that I would say is changed is that I do so much less than I used to do, right? Like I won't drink out of plastic bottles. No matter how desperate I am or thirsty I am, it's just not happening. I have my water bottle with me all the time. If I'm drinking tea, like I have my glass mug, I will not drink out of a plastic anything ever. I don't cook in plastic. I don't cook in nonstick. I don't use aluminum. I don't use disposable things. I don't use disposable utensils. Like I just don't do it. I will go without before I will do those things. So I have decreased my toxic load really, really, really significantly. And then, I did have some individual things that are probably not true for everyone. Like I had a huge mold exposure and that's not everyone's problem, but it was my problem. Right. And so dealing with that and just getting over that and treating that had a big part of my recovery. And I will never go back to what I used to do. Ever, ever, ever. Like it wouldn't occur to me and it will never be okay. So I will never have like a normal piece of birthday cake again. Sometimes for my birthday, which is today, my husband will get me like a gluten-free, vegan, some kind of confection that my 17-year-old says, "Oh, not that," right? But it's okay. I mean, we just retrain our palate to look at things differently, and what ends up being delicious to us now. Nothing. My aunt used to say, like, nothing tastes as good as thin, and I changed that to say nothing tastes as good as healthy.
Exactly. And it's a balance. I can easily say no to the birthday cake, especially those made with seed oils and all of that kind of stuff, because I know that I am going to fly on planes and I am going to encounter toxins in other parts of my life that are not as easy to get away from. So
For
it's
sure, for
definitely a
sure.
balance. You
And
brought up
I'm not perfect. Like here
no,
I am with my hair color,
right,
and
exactly. That's another
I'm
one. People
not
are
giving
like,
that up anytime soon. I
how can
have,
you color your hair? I was like, well, I choose that as
yep,
opposed to
you
plastic
got to
water
pick your
bottles.
poison. You got to pick your
So
poison.
true.
I don't do Botox. I don't do fillers. I get notes all the time saying that I'm lying. It's just not true. I
Hmm.
line my lips in a way that it looks like I do, but I don't. And I just am not ready to look like my mother. And
Hmm.
when I am, I will, but
Right.
it's not yet.
Yeah. You are one of dozens of guests who have mentioned mold. That's a big, big topic for another time, but a lot of people are experiencing that. So that's a
Yeah.
whole other big thing.
Yeah. That's a bitch because your
Yeah.
brain does not work
Yeah.
and you just don't understand why. And you're lying in bed at night and you get these shooters, like these electric shocks that just run down your body. And you're like, what the hell was that? Like you feel like you're being electrocuted. And you go to your doctor, who is your friend and colleague, and they make you feel like you're nuts.
Yeah.
They make you feel like you're insane. Like, okay, Jen, all right. But it was very, very real to me. And it took years to clear it. Years. Because these things take years to build up and they don't go away so fast. They for sure don't go away overnight.
Wow. Yeah, it's a big topic. Well, we're going to link the QT imaging. I would love to link the tear test
Yes, we for
as
sure
well.
will. Yeah.
Your book. Um, Tell them again where they can find that.
Right. So my book is The Smart Woman's Guide to Breast Cancer, and you can get this at Amazon or on my website, which is realhealthmd.com. And the ARIA test you can also get
ARIA.
on my website, and that is at PerfeQtion Imaging, and perfection is spelled with a QT in the middle. It's the home of the QT imaging. And what I generally recommend is that every year for screening, you're doing your self-breast examination, you're doing your ARIA test, and you're doing your QT. And then if you are at high risk, in between, you're doing another ARIA test just to make sure that you are on top of that inflammation. And if it comes up that you do have the inflammation, identify it, work on it so that you have the opportunity to prevent a breast cancer diagnosis. Because in fact, that's what we all want. We want to be proactive about our health, and we want the opportunity to prevent a cancer diagnosis.
And for those of you who have been listening to this podcast for over a year, I wish that I could tell you that this is something brand new. I mean, a lot of the information is, but as Dr. Jenn is saying, like every other episode that you hear, it goes back to how you eat, how you sleep, how you move, relationships, and spirituality. You can't out-test, you can't out-supplement if you are out of balance in those areas. So you've got to go back to the basics.
Absolutely. Absolutely right.
So important. Thank you for spending time with us, especially on your birthday. Tell everybody where you can find you specifically.
Yeah. So you can find me on all the social media outlets. I'm at Dr. Jenn Simmons, and my Jen has 2 N's. If you have a breast cancer diagnosis or you know someone with a breast cancer diagnosis, my medical practice is realhealthmd.com, REAL, healthmd.com. If you're looking for a scan or for the ARIA test, it's PerfeQtion Imaging, PerfeQtion imaging.com. And if you want to do the ARIA test, it's ARIA, AURIA.care, and use the code DrJenn20, DRJENN20 to get 20% off.
Thank you so much for your time. So good to meet you, and happy birthday. Hey, want to hear the extra content? Join our YouTube channel membership. Tap join and pick the level that fits you. Coming up on the next episode of StRest, we're going to be talking to Katie Wells. She is the host of The Maximized Minimalist and also has a new book out called Making Home Your Happy Place. Why clutter, why the stress of the stuff could be actually what is making you sick. It's more than just stuff everywhere or clutter everywhere. This could be part of the root cause in your chronic condition. We're going to talk to Katie Wells on the next episode of StRest.
If you're enjoying the show, don't forget to subscribe and leave a review on your favorite podcast platform. Your reviews help others find the podcast and join our community. Follow me on social media at Kerstin.Lindquist for daily tips and inspiration. And visit my website at www.Kerstin-Lindquist.com to sign up for our newsletter and receive exclusive content. The information provided in this podcast is for informational and educational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding a medical condition. The host of this podcast is a certified health coach and medical researcher, not a licensed medical professional, and the content shared does not constitute medical advice. While we strive to provide accurate and up-to-date information, we encourage you to do your own research and consult with your healthcare provider before making any changes to your healthcare treatment plans. Thank you for joining me on this journey to reduce stress and make room for rest. Remember, you're not alone. Keep coming back, share your story, ask for help, and give yourself grace.